all of a sudden she's like, well, look at that. How does that make you feel? And I was like, horrible, thank you.
And then she said, tell me more.
And I said, more I will tell.
Welcome, everybody. I want to start by introducing Nick Harper, who is the owner of this amazing studio and artist. Nick, if you would stand up. Thank you for having us every single month. You've been an amazing host. I want to introduce the topic next. Welcome to Tell Me More. My dear friend Terry has been talking to me about this episode for about 3 years, and this is both personally and professionally a very significant conversation for me. So this episode again, surrounding what it means to live long-term with HIV is critical for me. I met Terry in 1993, I believe it was. You were a case manager for HIV-positive individuals at HCMC. I was at the Minnesota AIDS Project as an intern, and I was periodically running over there to meet what I thought was a very different group of people. You were very quiet, and eventually we ended up working together. Oh my God, you were eating every meeting. But I will tell you that part of the reason this is important to me is twofold. One is this really started my career. When I was in my graduate program at University of St. Thomas, I approached the Minnesota AIDS Project for an internship, a practicum, to get some educational credits, etc. I really had no idea what I was in for, but it was a tremendous but very, very painful experience in the early 90s when people would quickly get diagnosed and most likely have a death sentence. And it was a rapid effort to try to get people some support. I remember the first time I sat with John Ferguson, my supervisor, and my dear friend, shout out to Elizabeth in Sweden, who I'm still dear friends with. I sat across from an 18-year-old who had been ostracized by his family and turned down for care by his physician. We did not yet know enough about transmission. We did not know whether or not him breathing in that facility was going to harm anybody, and the ignorance that was at that time that we didn't know enough about, but that was what was happening at that time. I saw families, we saw friends, we saw communities kind of ripped apart by this virus. I realized later, I was watching the Dallas Buyers Club on some kind of pay-per-view on my TV, and I cried for days, and I realized that I have a very traumatic sort of response to having worked during that time period. And so even today, I work a lot with long-term survivors. Thank you all of you for being here who are positive for that amount of time, which we've talked about is 10 plus years to constitute long-term survivorship. But yeah, this is an important topic. A lot of people think that HIV is kind of gone. I've had so many conversations with people who are not part of the community who think it's over because people are surviving. That is not the case, and we are here to talk about that today. I want to dedicate this to everybody who died and for everyone, of course, who survives in a long-term way from this virus. So welcome. I'm going to go through each of you and talk a little bit about who you are, and I'm so grateful you're here. I got so excited. And as we were talking the first hour or so since you've gotten here, I'm like, I feel like I'm at home. And I feel like, the four of us knew each other for a long time. And I did know you for a long time, but I feel like I know you two really well and appreciate your disclosures so far. I'm going to go through each of you. So Patrick Ingram is this gentleman right here. We shared pink and jeans today. Is a public health leader with over a decade of experience advancing health equity through community-driven programs and partnerships. He's currently pursuing a doctorate, congratulations, in health administration with a research focused on Black queer male leadership in healthcare. Patrick has been recognized by HIV.gov and Minnesota Public Radio for his work expanding access to PrEP and MPOX, which we're going to talk a little bit about and what those mean, because most people don't know what that means. Vaccines in communities of color. He currently leads the planning of the 2025 Minnesota Statewide Conference on HIV, the first of its kind in the state. Welcome, Patrick. And this delightful person sitting next to me is Sherry Outen. You are a good-looking 57-year-old survivor.
Thank you.
Living with HIV for 14 years and a Minnesota resident for 9 years. She served on the Members Advocate Committee Board for over 5 years. Sherry also serves on the Community Voice Committee. She's committed to continuing to help put the word out in the community about HIV and stigma for people of color. And stigma is something I want to talk about a ton today. Because while I would love for it to be gone after all this fucking work that we've done, it's still not. So we'll get there. And now my dear friend Terry, I'm going to read your entire bio because you deserve every accolade. Terry Wilder manages the HIV aging policy advocacy portfolio at SAGE, where she implements the organization's federal and state HIV aging policy priorities. She's worked in HIV care and services since 1989, providing social services, directing educational programs for clients and medical providers, and advocating for policy change. She's an experienced public speaker. We will find that out today. Who has presented at conferences around the world on a variety of HIV topics. Terry's also an award-winning writer who has published on a variety of HIV-related topics through the body's website, among others. Terry served on the New York Governor's Task Force to End AIDS and the New York Governor's Hepatitis C Elimination Task Force, where she contributed to the development of state plans to end the HIV epidemic and eliminate hepatitis C. So much to say there. She's currently a member of the New York State Department of Health AIDS Advisory Council subcommittee and just finished a 2-year term on the Minnesota Council for HIV/AIDS Care and Prevention. Terry's been recognized for her work via the PAWS 100, Celebrating Women edition of PAWS magazine, as well as awards from the New York NYC DOH AIDS Institute, AIDS Survival Project, and Bridging Access to Care Incorporated. She's a senior lecturer at Columbia University Graduate School of Social Work, teaching human sexuality, gender and sexuality, queer theory, and healthcare policy. Impressive group of people. Thank you all for being here. So I kind of want to start by just bringing up the topic itself. And as I said before, there's a lot of people in the world who don't believe HIV is a topic anymore. I had actually some people at a dinner party at my home say, is that still around? And it's kind of an interesting thing that people don't know what's happening in the world today related to HIV. And I want to ask each of you why this conversation is important to you.
I've had many friends that has passed with the virus. And when I found out myself that I was, diagnosed with it, it bothered me at first. But I know it was an academics out there that I wasn't really like in the 60s to the 90s when it was people were just dying and dying. I got into it when they were doing the research with different medicine and stuff like that. And when, like I say, when I was diagnosed, there was a lot of trial medicine. And that's what I was put on, a trial medicine. And then I just wanted to just find out where it came from, how it started. Is they going to really work to try to get a cure for it? And my mother, she was a nurse, and she had friends that worked for the CDC. And I was embarrassed because I was diagnosed with it. But I was like, I want to help people with this, especially after my cousin had died from it. And I'm like, people of color, they worry about what people say. And I was one of them too. I had stigma real bad. And I was just wanting, to just get into it and wanting my mama to accept me, which she did, and my family and everybody, so I would not feel a certain kind of way and could get in society and meet other people that was the same as I and find out how they felt and whatnot, especially, people of color, because they hide. Their family don't accept them. They commit suicide. They do, they don't have nobody to talk to. They don't know about the different groups and stuff to go to get the help. So that's why it was important to me to help people to get them where I'm at, even though they're not like me. So, that's basically why I'm into it and really want to get not just people of color, all people.
I appreciate that, all Sherry. People. I'm also very eager to talk to you more about what it felt like to get diagnosed. You talk about wanting to hide as well and having some shame around that, especially knowing someone from the CDC, which you and I both know that we can all become infected. I mean, any of us at any time could have, and we've all had some unprotected sex at some point. So there's a lot of ways that happens. So we'll get back to that. Thank you.
Yeah, I mean, I think my thought of this, it's, for me, my own personal experience, it's multifaceted. I think, I was born in '89. My father is in the military. I spent the majority of the '90s abroad between Japan and Korea. My father was stationed there. So wow. at the the peak of our community being impacted greatly, I was not here. I did not see it. Surely, I remember, seeing, the Red Hot Chili Peppers on MTV, right? Though that's kind of like the highlight of my '90s. But, hearing and seeing about ACT UP and the advocacy and the activism that took place was not really at the forefront of my life because I was not in this country. I think, growing up Black in a Southern family, we have these conversations, and you probably are very familiar with this. We have these kitchen table conversations, and for Black men, typically, and I don't know if your family has this conversation, but it's around like the 3-strike rule. 3 strikes and you're out. For me, I had this conversation of like, the first strike is you're Black. You're a Black man in this country. That already is 1 strike against you. The second one is that, and this is early on when I came out in high school, is that you're gay. So you're a Black, gay man. Like, these are 2 big strikes against you already. People are going to look at you and treat you differently, not only in your community, but when you go out and try to find a job, when you go out and try to go to school, when you go out and just want to be safe and date or just find love. And the third one that they said, and this was like, 2003, 2004, was like, if you get AIDS. That was this was like the first, when I came out to my parents, this was the first kind of kitchen table conversation we had. And they were like, these are and this is at this point like strike 5, I guess, in life. But, I think these were the narratives that were in my life as I was growing up. I think as a young person, we tend to think, if you think back in your life when you're a young person, you tend to think that I'm invincible. Nothing's ever going to get me. I'm perfect. I'm healthy. I'm out here like not getting sick. I'm not breaking bones. I'm healthy. And I think I carry the majority of my life in that way. And I think a lot of pieces too that we don't talk about are some of these foundational pieces. In the South, we didn't have comprehensive sex ed, right? It was really heavily abstinence based. We weren't talking about, safer sex practices around, same sex practices. What is it like to have safer sex as a gay man or a same gender loving man? And so for me, and I know we'll get into this, but like my diagnosis and how I was treated really triggered my interest in not wanting to ensure that someone else like me had to go through what I went through. But additionally, I think another piece of this is recognizing I was diagnosed World AIDS Day 2011. And almost a year later, we had the introduction of PrEP, medication used to prevent HIV. And so for me, that's big for me because that's something that if I could have held on just a little bit longer, that could have been something that I could have utilized realistically to prevent HIV. And so that's something I carry. I think additionally, I carry the fact that my ancestors before me, and I think Terry and I have talked about this a little bit, like, we're dying and we're out there fighting for their lives for what we have today as resources. I mean, I have medication that's injected in me. I have long-acting injectable medication that I have the ability to have access to. That's not because we have scientists in the lab doing the work. That's because we had activists on the ground advocating for advancements that we're able to reap the benefits of today. And I think people tend to forget about the lives that were sacrificed to ensure that we can benefit and be healthy today.
Patrick, I so appreciate you saying that. I think that's one piece that I might have kind of missed in the introduction, is that I think one of my biggest irritants is that I think especially the population, the LGBTQ population, but also the heterosexual population, have a very hard time kind of understanding what happened and the fact that all of these people died with experimental drugs that we knew nothing about in order to the advancement of what it is that we have today, including that injection that you're taking, which has not been around for very long, right? So a lot of people are still taking daily medications. It's down to 1 pill from like 20 some, but how amazing that is over the course of time. When did you come out to your folks?
Ooh, it's funny. It's
or
three,
when did
it's like
somebody
3
out
parts.
you
It's
to
like
your
3 parts, right? The first part was like, I think I'm different. The second part was like, I think I'm bisexual. And the third part was like, I'm full on gay. So I go with the third part. That was my junior year of high school. My junior year, so like
so what year was that?
2002, well, not 2010, geez. 2006, 2005.
And they still were concerned that you'd get AIDS?
Yeah.
Okay.
Yeah.
Okay.
I mean, and it's funny, I was diagnosed World AIDS Day, December 1st. I came out basically to my family and told them that I was living with HIV like Christmas Eve.
Okay.
And they were like, why'd you wait so long? And I said, I had to be ready to deal with rejection and be ready to deal with your response of me essentially striking out in life before I told you. You were not my first phone call, right? Like I literally had a fiance or somebody, we were trying to get married, that I had to call that day I found out and said, hey, I know we had sex last night, but I just found this out. And had to navigate that for, 28 days. I was not in a position to tell my parents. So yeah, I mean, I think we're in a good space now. I've given them a lot of education. They have access, they have phones. But yeah, it's wild how you think about the foundational training as a child you get from your parents and how that translates and evolves as you get older.
Yeah, I mean, I think your original question is like, why is this conversation important? And it goes back to, something that I related to is not that long ago, I'm from Georgia, which I'm sure everybody can hear my accent.
You have an accent?
I know, because Minnesotans don't. I was doing these lobby visits at the Georgia State Capitol, and I had a bunch of social workers with me. And so I said, we don't have an appointment with this person, but let's just pick a random office and see if they'll let us talk with the legislator. And we got in there, and they were very nervous. The social workers were nervous. And I said, I promise you, we know more about HIV than they do. So we are the experts. So don't be nervous. They're just people, Let's have a conversation. And so we, got in and said, we're here to talk to you about an important public health issue. And we start talking to them about HIV, mainly around conserving the AIDS drug assistance program in Georgia. And I kid you not, this elected official said, I thought we had a cure for HIV. And I thought, good Lord, if we had a cure to HIV, I wouldn't be here. I wouldn't be having to have this conversation with you. So when I walked out, we got a little further down the hall, and I turned to the students. I said, what'd I tell you? We know more than they do. This person thought there was a cure. There's not. And so, having these conversations is important because there's still misinformation, even at 2025. I mean, it's shocking.
Isn't it shocking, Terry?
It's shocking. I mean, I do this work every day, so I'm in a little bit of a bubble.
Yep.
But it's shocking that people don't know. And, this hasn't gone away. We have, in the United States, about 1.2 million people that are living with HIV. And in 2022, we had 32,000 people that were diagnosed with HIV in our country. So that's not insignificant. And then, when we look globally at HIV, we have about 40 million people in the world that are living with HIV. So, this isn't something that's from the past. It's in real time happening. And, I just think that it's shocking that what's happening right now in our country, taking away Medicaid, trying to go after Medicaid, 40% of people with HIV, the way that they get their health care and other services is through Medicaid. So if that gets destroyed, and I'm hoping everybody is calling their senators, you have two, so you have to make 2 phone calls. If that goes away, what is that going to do? Because the Ryan White program that was introduced in the 1990s, and Elizabeth Taylor, God, the queers are so smart. They brought Elizabeth Taylor to give public comment that day. Because guess what? You get a sexy starlet in a room, the straight men that run our country, they gonna show up and vote.
That's right.
So the Ryan White program is not gonna be able to absorb it taking care of people with HIV if Medicaid goes away. We're gonna be in a crisis. And people think, oh, you're being dramatic. No, people are gonna die. They're gonna die. They're not gonna have access to their medicine. They're going to lose a lot of things that help support them live and navigate life. And, I am very grateful. I mean, I'm a heterosexual woman from the South. People would have thought HIV is never going to touch your life. Well, it did. I had people in Marietta, Georgia that I know that died. The first one was my hairdresser. And then it just, kept happening after that. And I'm very lucky because I was politically raised by the best people in the world. And that is LGBTQ plus people and people living with HIV trained me politically through ACT UP, local chapter in Atlanta, Georgia. I am so grateful that they taught me that silence equals death and that knowledge equals power and that we have to speak out and that in this time, it is about protecting lives and preventing people from dying, and that you have to speak up. So I am so grateful that they taught me that and taught me to just, be bold. And as Patrick always says to me, meet the moment. Like, we have to meet the moment right now, because we could very quickly go back to where we're burying our friends.
Yeah, and let's be clear. I think the big thing is Ryan White is also going to be under attack. It's not happening now, but the attention will focus back on Ryan White at some point, and it will become an area of concern. And so I think it's important to think about a worst case scenario where we have no infrastructure to support individuals living with or affected by HIV. It is the reality of what we are potentially facing. And I think we have to recognize, and that's something, again, living with HIV for 11 years, I've been sitting in a space of privilege, and my life right now, I am panicking because at night when I lay down, I have to think about if I work at the university, if my funding goes away and I lose my job, am I Medicaid eligible? If Medicaid goes away, can I lean on Ryan White? But if Ryan White goes away, how am I going to get my medication? So there are conversations in community that are happening saying, do we have to go back to what we did before, such as saving our medication? Should we start this again? So, it's a reality. And I think people who are not in this bubble of being affected by HIV are not necessarily thinking about it. And I think it's really important for folks to really recognize the fact that we are moving into a direction of resource scarcity. And we may see individuals going back into that space where we are haunted and we are navigating trauma. We may have to dip back into there. And I think the first indicator is where we're going to see are that we see communities of color, individuals who are undocumented, and individuals who have lower health literacy beginning to be impacted first. That's something we really should be deeply concerned about.
Anything you want to add to that, Sherry?
I just feel like, not only with Y and Medicaid, you have HH, different other, programs that help people get their meds. And it's scary to me because, I haven't worked in like 9 years. And, right now I look wonderful. But if they take all these things away, you think I'm going to look like this?
So go into that a little bit, because I don't think people remember what that looks like if you're not medicated. Tell me what your fear is.
Just not being able to get my medicine, not being able to go to the specialist that I need to go to, getting my lab work to see where I'm at.
Opportunistic infections were a thing of the past, and we have prophylaxis for that.
Yes.
But if that goes away, will we see Kaposi sarcoma again? Will we see those things that we were able to prevent before? I want to make a reference to what everyone is talking about. We're talking about Ryan White. Ryan White was a little boy who died of HIV-related causes. Elton John was a big, huge supporter of him, but that fund that we're talking about was named after him. And the HH program that you just referenced is Minnesota-based. And it is a service run by amazing people who help out with a number of different services. They help out with the mental health services that some of my patients are able to receive. So it's a critical service. And if it goes away, I don't know what that looks like.
Yeah, Ryan White is the largest funder of HIV services in our country. Mm-hmm. And it was introduced in 1990, like I said, and it's been reauthorized a couple of times. It hasn't been reauthorized in a while. And the money has kept flowing, but we've purposely, and I say we, I mean like the activist community, the HIV community, has tried to keep a low profile about the fact that it's not been reauthorized because of certain precedents that we currently have and have had in the past. But now we're thinking, should we have gotten reauthorized? Should we have fought and put it on the radar? Because now what's happening in our federal government, where they're going after everything. They're cutting staff at the Centers for Disease Control. We have a division of HIV prevention that the staff has just been cut. What is going to happen with our HIV prevention efforts if the division of HIV prevention goes away? AmFar did some analysis, and when they looked at what if the Division of HIV Prevention 100% went away, if it went 50% away, and looking at projections of death, number of people that would acquire HIV, I mean, it's breathtaking what would happen if that division goes away. I mean, they're going after our researchers at the National Institutes of Health. And, you know, I'm very concerned about that. You know, that research is why we have medicines. It's why we know how to prevent opportunistic infections. And, you know, some people, you know, like my parents are musicians. Like, you know, when I talk about HIV research going away is terrible and it's going to, you know, slow down discovery and slow down our reaching to get a cure. But one thing that I think people don't understand is the research that happens in HIV, we all benefit from it, whether you have HIV or not, because what are they studying? The immune system.
Which had an impact on COVID and our ability. Yep.
Our HIV researchers are who they went to when the COVID pandemic started. You know, which is why it's disgusting that people went after Dr. Tony Fauci. Are you fucking kidding me? No, they know more about the immune system and viruses than anyone. And they met the moment. Everybody went to the HIV science and medical field and got their advice to try to figure out, how do we prevent this from transmitting? How do we come up with a vaccine? How do we keep people from dying? And so, you know, that was an interesting time in our history where it really showed why science benefits all of us. And, you know, one thing that I do want to put a pin on about the COVID pandemic is that brought up a lot of trauma for people with HIV.
It did.
Because that was their second global viral pandemic. And it was very triggering. I mean, it triggered me. I mean, because I started in 1989. And, you know, we have a lot of folks in our community that have PTSD because they lost hundreds, if not thousands, of their friends and family. And then you watch this global viral pandemic killing people all around the world. I mean, that triggers you. And we saw an increase in mental health, and I'm sure you saw it too.
I saw a dramatic increase in requests.
I'm sure you
All
did.
of my old patients were trying to get back into my schedule. I want to comment on what you said, Terry. It's PTSD not only for people who are positive, who lived through the epidemic, but also people who are providers.
I have trauma. I have PTSD.
I know. When as I told the two of them, you know, when you and I first talked about this, I have this weird, horrible dissociation. I can see every person in their deathbed that I held hands with, or their parents were outside because they wouldn't go inside for fear of infection. I remember taking people off their IVs to take them to the lake for the last time.
Yes, I remember.
I know you, and you covered for me because I would have lost my license, right? But I would do it 1,000,000 times over. And how many times were families outside and they would not go in and say goodbye to their children who were dying? Yep. And I remember grabbing one of them and said, "Get your ass in there and say goodbye and tell them you love them," right? It was just so sad to work at that hospital at that time. So the thought of this happening again, like, I really appreciate you bringing up fear that this could possibly happen again. I don't know what I would do to survive that as a provider. Like, I don't know how I can hear that again. It was horrible. It was devastating. People were so ostracized from their families and friends. And I don't want that to happen again. I don't know what to do. So, but I'm going to do something, including this. By the way, thank you all for being here. So this is part of what I do. You both reference your initial diagnosis. I kind of want to go back to that. So tell me more about your first response.
A friend of mine had been incarcerated for a year. And when he got out, I picked him up and he told me, he said, I'm going to have to go to the health department to get checked because they said I had hepatitis C. But they don't know. They referencing it from HIV to hepatitis C. And I had been going to see him, but he would never tell me even about the hepatitis C. I said, okay. I said, I'll go with you. So when we got home, the next day we had an appointment to go. So I said, well, if you're going to get checked, I might as well get checked too. So I went ahead and got checked. And I had a male counselor that, you know, told me, Sherry, come on and let's go in the back. So I said, well, what's the procedure of, you know, I thought they were going to draw blood or something. And He said, no. He said, I'm just going to swab your mouth. I said, oh, okay. Me, every 6 months, I would go every year to get my checkup. I would have an HIV test done. I didn't expect that at all. So he said, we just got to wait a while, to get the results. I said, okay. He said, are you nervous? I said, yeah. I said, because, my mother's a nurse. She got friends that work to the CDC. And I never wanted to embarrass my mother about anything. And so my heart kind of dropped. He said, we got a few more minutes. I said, okay. And when he told me, I just looked at him. I was numb. I didn't know if I wanted to scream, shout, or holler. And I just got numb. I'm like, in my mind, I was saying, what I'm going to tell my mama? They put this in a database. My mama friends are going to see this. Because my mama used to do lectures for, HIV. She used to draw blood for HIV testing and stuff. And she used to do seminars with the condoms and stuff. And so I said, Lord, what I'm going to tell her? And it took a while for me to tell her. And I just started crying to him. And he gave me a napkin. I said, Lord, people going to talk about me. People going to say all kind of stuff. And I don't know if I want to be with him or not, And then when he came out, he told me he was positive too. And then they drew a lot of blood from us. And I just looked at him. I was undecided. I wasn't upset right then with him. I was just numb. I didn't know what to say to him. I didn't know if I wanted him just to go on about his business or whatever. But as days went by, we was talking about it and we made a little joke about it. And I said, well, I guess if we get down where we can't help one another, we'll just flip each other and clean each other. We just cackle about it, right? And then when I told my mom, she was like, well, I think you just better go to the doctor and take care of yourself. And then she went to telling me things to do and who to contact and stuff like that. And I just did what she told me to do. But then it was my 3 sons. What people gonna say to them? Are they gonna pick at them? Are they gonna say, oh, your mama living with this, your mama living with that? And it was just a number of things going through my mind. And I would cry. And I would just, I would think about death. I would think about me losing weight because I worked in a nursing home. So I saw a few AIDS patients, not literally HIV patients, but people living with AIDS. And I was like, oh God, I don't want to be like that, and whatnot. But once my mama accepted me and my children accepted me and even my ex-husband, he loved me like it was, he loved me like he loved me when he married me. And once them and my family, and I told them, I wanted to help. I wanted to help. I wanted to get in and let people know it's not a death sentence. What do AIDS and HIV look like? Because it didn't look like me.
I was going to say, it looks like you.
So I just, ever since I came to Minnesota, and I see that there's a lot going on here than it was home. We didn't even have support groups. We didn't even have that. I just had a case manager come to my house and I would have to go to her and that was it. But when I got here and I got more educated and I saw that there were places to go, people like me, and we could talk and we could just do other things, not necessarily talk about HIV, but then make a difference. I was like, wow, I'm in the right place.
The state does a lot of good stuff.
Yes.
It always has.
And that's why we don't need Medicaid and all Ryan White and all that taken away. We don't need, we need that.
Yep.
That what makes us going. That what makes us healthy.
Survive. Thrive.
Yes,
Yep.
yes. So I'm happy where I'm at, but I'm also upset because our president trying to take everything. You
I
know?
like the quotes.
Yeah,
Yeah.
thank you for putting in quotes.
Yeah, because it's hard out here when you living with something and you don't have what you need to survive. It's hard.
When I think it's a long story. It's like a chain of events. But, when I was in the military, one night I had like what was like the worst flu of my life and was hospitalized for 2 days. No one knew what was going on. And then I bounced right back, fine. And since then, kind of talked about this like kind of youth kind of invulnerability. You'd go to your doctor for checkups and they wouldn't ask about HIV. They'd just be like, oh, just regular checkup. You get your gonorrhea, chlamydia, and syphilis testing. And, if they're not, again, being like 18, 19 years old, if you're not asking me, I'm not pressed about it. I'm like, okay, well, it's fine. I think for me, what drove me to go get tested, I began, I think in late 2000 or like mid 2011, I lost a lot of weight. So I went from like 165 to like 135. I began to get thrush all in my mouth, all in my throat. Began to have terrible GI issues like diarrhea all the time, felt exhausted. And I was in denial for a bit. I mean, I would get a tongue scraper, y'all, and I would scrape off the thrush on my tongue.
Like Patrick, I hear the word thrush and it just pulls me back into the
2011. 2011.
Yeah.
2011. I
hear
was
you.
scraping
Yep.
the thrush. And like WebMD was alive and popping. I'd go into WebMD and see AIDS. And I'd be like, yeah, I ain't got that.
And the fact that nobody caught any of these
Nobody
signs.
caught it.
I'm not a medical provider, but if somebody came to me and they had thrush, I would be talking about, can we have a conversation about an HIV
had
test?
my adenoids and my tonsils removed that year. And they were
no one
like,
tested you.
they were like, you need an HIV test? And I was like, okay. No one ever got back with me. No one said anything about the thrush. Nothing.
Do you assume that you seroconverted when you had the flu?
Yeah.
Yep.
Yeah. Or that's what I think.
That was acute HIV.
Yeah.
That was
acute. It was happening. And so I sat for years not knowing. And my providers didn't say anything. So I think another important thing, I'm going to take a off ramp and then get back on. I think when we talk about Ryan White funding, it's really important that we talk about it comes in different parts. So Part F has a piece of it that's tied to AIDS education and training centers. And that money is going away.
Yep.
I think as of right now, effective July, if they are not funded, AIDS education and training centers are going to close. And these centers are really critical because they provide education to providers around HIV and AIDS. And again, we still have providers to this day that are not educated on HIV and AIDS. It's 2025, y'all. Yeah. And in 2011, there were a tremendous amount of efforts, especially in the South, to bring resources. But obviously, if I'm walking around with thrush in my mouth and wasting and having diarrhea and going to doctors and no one can figure it out, it speaks to the lack of knowledge. And so, moving on to my life and World AIDS Day, I was at work and like on YouTube, like a World AIDS Day. And I talk about this on my blog.
What were you doing for work at that time? I'm curious.
I worked at a high-end car rental agency in DC.
Okay.
And so it was go, go, go.
Yep.
I was exhausted, but I was going, trying to make my money and trying to go to school part-time as well.
And trying to ignore what was going on with your body.
Full apathy. And let me be very clear, because I there's no shame in it. I was living my life. Like I was in these streets. I was in these streets.
As you are entitled to be.
I was in these streets. I was living my best fuckboy life. Let's be very clear. And so, but again, I think that's important to note as well, because again, it speaks to then and now. Nobody was asking me like, what's your HIV status? When's the last time you were tested? They were like, you good? And I was like, okay, yeah, all right.
Yep, that's how it works.
I think when we talk about like me, when we talked about this pre-show, but now me being like, divorced and single and dating again, that is like as an adult conversation, it's completely different in terms of how I was having this conversation in my 20s. But in World AIDS Day, I was watching this live YouTube stream. Bono from YouTube was talking about like, AIDS in Africa and like why funding was really important globally. And I went into the bathroom and I looked in the mirror. I stuck out my tongue. I looked at my tongue. I looked at like, the hollowness in my eye. I just looked at myself. And I was just like, Pat, like, if you don't go today, you're just going to die from apathy. Like I like literally had, so I called my boss and I was like, I gotta close the store. I got something I gotta do. So this was in Arlington, Virginia, DC metro area. So I drove to one health department, they were closed, and I was like, I gotta go to another one. Went there, got tested, and she came back in. Well, as I was getting tested, she was like, so I take it that you bought them. And I was like, this bitch. Okay. All right.
Yep.
Just judging. I mean, just, okay, like, so are you doing, like, what kind of hard drugs are you doing? Bitch, I don't do any hard drugs. Like, again, like these experiences, right? And so, like, I'm being judged from the front, like, no kind of empathy. Again, if you were to look at me in a picture and see what I look like, you'd be like, you were sick. Bro, you were sick. There was no empathy. She came in and was like, do you have HIV? And I just like lost it because I, had a kind of like a fiance and was thinking about my future, and I got left alone to navigate that. But then she comes back in and she goes, listen, we got an HIV clinic going. If you're not suicidal or you don't have any thoughts of harming yourself, I really need you to leave because I have a line outside.
Holy shit.
Oh my God.
Okay.
So I got like a piece of paper like here, like literally a piece of paper with some resources. Sorry, I'm kind of sharing your tea on your resources. But I had a piece of paper that literally just had some clinics. And she was like, well, you need to just follow up. And that's what I got. So I took it home. I tried to call the clinics. Nobody answered the phone. Shout out to I Know Juniper, you never answered the phone. And I sat trying to get into care. And I had another friend that I was like friends with who was also positive. And I was like, I don't know what to do. And I'm the kind of person, like, I'm about my shit. Like, I'm gonna do what I need to do. I tried, but I was giving up. Like, I was sick. I was barely getting to work every day. And the only reason I was because I literally worked right next door. And so my friend basically got me to Whitman Walker Health in DC. Like, literally helped me fax my paperwork in for the red carpet program and literally picked me up, got me on the metro, and dragged me into that clinic.
Which that clinic is, of course, a role model for a lot of clinics.
Dragged me into that clinic. And I don't get emotional. But I'm emotional. But I think the big thing about this is that I also, like, again, my parents, I didn't feel like I trusted. I had what I call a gay dad. His name is Calvin, lives in San Francisco. He went through this epidemic, saw his friends die. And I called him and I was like, I don't know what to do. What do I do? Like, and he walked me step by step every night. How are you? What are you doing? What's your situation like? Do you need money? Do you need anything? And, very similar to you, I got on a clinical trial, started that kind of route. But I think the first thing I met Dr. Maddie. He now it was Whitman Walker. I think he's at AHF in DC now. When I first met him, he was like, you're gonna be fine, but I'm gonna give you some homework. I need you to go home. I need you to educate yourself. Here's some resources. And when you come back, I'm gonna test you because what I need you to know is when we work together, I need you to know what we're talking about. I'm not going to be a kind of provider that makes decisions for you. I want you to be actively engaged. And so
impressive.
Whitman Walker saved my life. And I think today, that's what triggered me to be like, I need to really kind of give that back. And again, I shout out to Minnesota. I love y'all, but I know I wear you out. I know I wear you out. But the thing is that what we see is that Black and brown and trans and non-binary and other queer people of color are disproportionately affected by HIV, sexually transmitted infections, and other sexually based issues. We're not even getting on the socioeconomic shit. But that's where, coming from the South, I feel like, especially with the anniversary of George Floyd's death, it being, I think, today, when we talk about the Black Lives Mattering, it's not about just putting a sign in your yard because you don't want somebody to pillage your home. It's about you really understand that Black lives really matter, and we can't address other pieces of racial and health equity. We can't address the issue of women's reproductive rights. We can't address these other larger pieces until we can really value Black lives. You can't do shit until you can value Black lives. And so the reason I moved here actually was my research interest around Black queer male leadership in healthcare, because there's none. There's not a lot. It's very limited. But also the bigger piece of, when we talk about Black Lives Matter, we've taken in a route around like criminal justice. We haven't really done the work in Minnesota to really address it from a public health and overall healthcare perspective. And we need to do that. And I think when we do that and we do it right, we can solve. I don't think we can, right now in the current state of shit, like we can't end HIV. It's kind of like measles. Like we can't end it. We can solve it. But Minnesota, we really, like as a state, we really got to get out of our silos. We really got to come together. We got to really like be really interested in being collective and incorporating everybody in solving HIV. It's so critical.
Patrick and I talk about this a lot. Again, we're all from the South. One thing for people to remember is that when we look at our country and we look at how it's divided up in regions, the South is disproportionately affected by HIV. And when we look at like the numbers that the CDC puts out, 50% of people that are diagnosed, the last data we have, came from the South. And what that means is that's a lot of Black and brown people. And in Minnesota, we have a white problem. It's something I've never seen before in my life. I lived in New York City. I'm from the South. When these HIV meetings happening, when people come to the table to talk about solutions, a lot of times it's all white people in Minnesota.
Mm-hmm.
And that's not what should be happening.
Well, but let's be clear. It's white, cis men. And even when women come to the table and want to give suggestions and ideas on how to solve the problems, they're ignored. So let's be very clear. I think it's a very one-sided, position trying to solve a problem that's going to take a collective effort.
Yeah. And we have to think about collective liberation, which people don't quite understand what that means. It means that if you're not free, I'm not free. And if I'm not free, you're not free. So we all have to fight for each other. We can't be like, oh, that doesn't affect me, so I don't really need to be interested in it. I got started in HIV in 1989 because there was a brochure at the School of Social Work at the University of Georgia that I happened to see as I was walking out the door after signing paper to graduate with my bachelor's in social work. And I happened to pick it up, and thank God, to this day, I don't know who put that down because it changed my life. And I could have picked it up and just said, HIV is never going to affect me. I don't need to think about this. Maybe I'll work with children or, food insecurity. But I picked it up because I was like, this is universal. This has so many things about all of our lives attached to it and how we treat each other and how we put certain people's lives at more value than others. And I'm about to get this degree where I was trained to care about people. And so I'm going to go to this seminar, AIDS 101, AIDS Atlanta's Action and Awareness Weekend, because I may think HIV is never going to affect my life, but I bet it's going to. And that's about collective liberation, seeing people's humanity and caring about them and caring about the fact that, we've talked a lot about the history today and the horrible things that, a lot of us were witness to, but the HIV community is so resilient. I mean, y'all both talked about, we didn't name it, but peers are so important in HIV. I mean, you had your gay father, who was a peer who kind of navigate. I'm sure people helped you that were living with HIV. Let me help you figure this out because somebody had to help me too. It's a resilient community that really, we fight like dogs, but don't fuck with us.
Well, I think there's another piece, and I've told you this before, and I'm going to name it because it's going to be on the record. Your writing also saved me. Your writing saved me, Terry. And I say this because, in my quest to try to understand and learn, I learned through your writing.
Really?
And for a while, I told you this, stop playing. And for a while, I don't know if you knew, but I was writing for the body, and I always tried to let me try to Terry my writing up.
Oh,
never
gosh.
could, never did. But when we first met here, it was just it's just timing. And I think it's just meeting your hero. And I think it's really important to note, that's important. The work that you do, the work that our folks from the 90s have done really inspire and support the current and the next generation. Like your work saved me. I don't think you understand. Like, and I think when I first met you, I was like, I've been like a fan of your work for so long. And I think like when I started planning this conference and my director, Sarah, was like, you got to bring Terry Wilder. I was like, Terry who? To who? Who?
I get to meet that
Terry,
celebrity, Terry Wilder.
Oh, to me, it's not a celebrity. It's just this person that is uniquely interested in improving the quality of life or having these questions that me as a person living with HIV have answered, and giving me access to people that know this information. Like, you're getting ready to go to Rwanda for a conference and you're scraping everything you have to go there to report back for people like me to be able to know what happened.
Yep.
That's huge.
Thank you, Patrick. I appreciate that. But I'm going to go back to who trained me. Queer people and people with HIV trained me. I only know how to do what I do because I was trained by the best.
Yeah. Before I got married, dating, that was hard. I found myself on a layover in Greece in a park, drunk on the floor, eating Cheetos, crying.
That's a description.
Wondering, it was a good description.
But you talk about having some fear. Like if you weren't with the person who infected you and who you shared that infection with, if you weren't with that person, how to disclose, how to put yourself out there strongly and confidently. Patrick is looking at you with some really strong eyes right now.